Another physician who made contributions to the area of public health is Ignaz Philipp Semmelweis. He is known as the savior of mothers, and this is the reason why. At this time, there were two different wards in the hospital where babies were delivered. One ward used midwives to deliver the babies, whereas the other ward used physicians in training. There was a higher death rate of the mothers that had physicians in training deliver their babies as compared to the midwives. He made the observation that the physicians often came from dissection areas, from dissection rooms, meaning they were dissecting people who had died and came directly over to deliver babies. This was not the case with the mothers. So what he did is he asked the physicians to wash their hands with a weak chlorine solution, and it resulted in a decrease in the death rates of the mothers in the wards where the physicians worked. While he could not offer an explanation, it was actually the truth, but his finding was ignored, and in truth, he later died in a mental institution because people said that he was not of sound mind. So let's watch a short video that talks about Semmelweis.
Next question. When did we connect hand washing to disease prevention, and who made that first connection? Well, according to Rebecca Davis at NPR, we owe that revelation to a Hungarian physician named Dr. Ignaz Semmelweis, though at the time no one really believed him. In 1846, this young obstetrician was interested in figuring out the connection between physicians' cleanliness and the spread of puerperal fever, also known as childbed fever. But at this time, germ theory wasn't commonly accepted as scientific fact, so physicians often focused on many different and primarily false causes of diseases such as bad spirits, misaligned humors, and individual disposition. Despite this, Semmelweis and other physician scientists were interested in making connections between anatomy and disease, and collecting data to prove patterns rather than asserting that disease was entirely unique to the individual. In particular, Semmelweis was invested in reducing deaths from puerperal fever, so he studied two maternity wards, one staffed by male physicians and another staffed by female midwives. He noticed that mothers in the clinic staffed by physicians died more frequently from childbed fever. At first, he postulated that it was because the mothers in the doctor's ward gave birth on their backs, and the mothers in the midwives' ward gave birth on their sides. But when he tried shifting the positions of the women in the physician's ward, he saw no change. Then one of the pathologists he worked with died of puerperal fever after pricking his finger performing an autopsy, which was kind of eye-opening to him because he discovered that anyone exposed to the disease could die and not just women who had given birth. Semmelweis then theorized that the real difference was that physicians were performing autopsies on patients who had died from the disease, while the midwives were not. And he thought that the physicians were transferring little pieces of corpse to women in childbirth, which was killing them as a result. Although not technically correct, it's actually very impressive that he was able to deduce this, considering he didn't know what germs even were. So Semmelweis made the interns in his clinic wash their hands and instruments with chlorinated lime solutions. As a result, fatal puerperal fever was reduced from an average of 10% to 1 to 2%. So hooray for the hand-washing Hungarian doctor, right? Well, actually no. Semmelweis's contemporaries didn't take kindly to his findings because they thought, 1, he was a quack bigger than Donald Duck, and 2, he was making it look like they were responsible for killing their patients by passing on tiny bits of corpse during childbirth. So he lost his job and was shunned by the medical community, even as he spent the rest of his life trying to convert other doctors to scrub up with chlorine before touching patients, which would have saved countless lives. He wrote a series of increasingly scathing letters, and in 1865, at age 47, he was committed to a mental asylum because of his hand-washing crusade, and a suspicion that he was losing his mind either from some form of Alzheimer's or syphilis. And he died there only 14 days later at the age of 47 after being beaten by the guards.
Recountings of the actions and observations of individuals such as John Snow and Dr. Semmelweis show how public health was moving forward even though they did not know how infectious diseases were actually caused. So let's move to the next era, which is the Contagion Control Era.